focused on the political scene in Arkansas.
And welcome back into Capitol View. Well, amidst the corona chaos ramping up in Arkansas, the federal government is working on provisions to help states and to combat the spread of COVID-19. Joining us now from D.C., Senator John Boozman. Senator, we appreciate your time this morning. How are things up there in D.C. right now?
Well, thank you, Jay, for having me. It's busy. This is certainly the coronavirus is a real concern. We're working very, very hard on that. The reality is that for most Americans, most Arkansans, the risk is low because it does seem to affect those that are in the senior age group. We're blessed. We've got the #1 infectious disease network in the world. We can be very proud of that. So we're working hard now to provide legislation to make sure that whatever we need to keep families and communities safe.
And speaking of that legislation, I know the initial coronavirus bill wasn't well received over there in your chamber. What are we looking at possibly changing, maybe even adding in here as we kind of get into the weeks to come?
Well, we've had two things going on, Jay. We've got the $7.8 billion that we just passed, and we did that in a very bipartisan way. That provides funding for vaccines, all of those kind of things. About $6.2 million at least will come to the state of Arkansas immediately to help our infectious disease network so that we can go forward with the disease. So we've got the funding piece, and certainly if we need more funding, we'll come back. The other concern is, what do you do about people that we're encouraging to stay home from work and things like that, hourly employees, the effect on the business community. So we're talking about small business loans, just a number of things. Again, trying to see if we can make arrangements to help the single mom that is struggling to begin with, and then all of a sudden, they can't go to work because it's shut down. So there's lots of things. So we're working with the president, working with our friends on the other side of the aisle to come up with some measures that will help us control this serious situation.
And even beyond the virus itself, you kind of touched on a little bit with small businesses, but what's being looked at right now, obviously with the economy, just even looking this past week at the stock market, how much of a roller coaster ride that has been. What are we looking at on a national level to sort of calm Wall Street down? And obviously there's that trickle-down effect.
I really think, Jay, the most important thing that we do is that we demonstrate that we're getting a handle on this. Certainly it's going to increase. Right now, the people that are in control of the decisions are the people in the white coats. I mentioned we're blessed. We've got the #1 infectious disease network in the country. They really are making a lot of these decisions that are so very important. So we need to control the disease. It's going to get bigger. We're blessed. We've got 300+ million people. We've got a nation that has 4 million square miles. So it is going to expand. The question is how much? So all of the things that they're putting in place are designed to prevent that. And eventually the markets, I think, will have confidence in that. We can do some other things, though, because businesses are struggling. And, the economy is essentially shut down to a large extent. So we're working hard. There was talk of a payroll tax and those kind of things. That hasn't been received very well, but just a number of things to see how we can help those that are in the business community, our employees, our employers, to make sure that people are taken care of so they actually can stay home without suffering greatly and help control this thing, which is the most important thing.
And I know helping to control it right now, I know one of the #1 concerns right now is just testing, and not only just the number of tests, but sort of the response. It seems like it takes a little while for those things to sort of be confirmed, and everything kind of works up the chain to the CDC. Is there anything being done to sort of move that process along?
Well, Congress is really pressing hard. Everyone is pressing hard at the state level. And let me just say how much I appreciate I'm an optometrist, an eye doctor, And all of us understand how hard the men and women are on the front lines, our providers that are doing such a great job and you know, truly are so skilled. So we need to support them. Right now, the testing is difficult, and that's been something that we've really failed at. They tell us that that's going to be taken care of very, very shortly. Really, the backlog is test kits themselves, but not so much that. It's just getting the testing done. And so there's been some jam-up points now. Dr. Fauci, who is you know, kind of the guy in this, basically what he's advocated, what we're going to do is just kind of allow the lessen some of the rules, allow the public sector, along with the private sector, to join forces and see if we can greatly expedite this thing. But that's been the real jam point now. What's happening in the short term, though, is as people are identified, they're treating them as if they have the virus, if they have the symptoms, and asking them to, you know, to quarantine themselves, which, even if they had bad flu, would be appropriate also. So we're doing the right things, but we do need to know exactly what the numbers are, and that will greatly help us. I think that we'll have that ability in the next few days.
All right, switch gears here. I know you've been working on some other things. There are some other things that are actually happening up there in Washington, but a veteran suicide bill that you've been working on. Kind of what's that one about?
Well, this is really important. For the last several years, we've been working hard on veteran suicide. We've spent a lot more money, a lot more resources, and yet the number of suicides have not gone down. And so what we are saying is, hey, we got to do something different. And so we're able to pass out of committee not too long ago a big bill, all-encompassing. Part of that was a part that myself and Senator Warner put in place, and that really has to do with metrics. We want to evaluate the programs. Now the only way that we evaluate what we're doing is based on the amount of money that we're spending and if you have access. But we want to know, are these programs that we're spending so much money on, are they effective? You know, are they actually doing the job? The other thing is that the VA itself can't do it. Only 6 of the people that commit suicide are in the VA system. There's about 20 a day. The rest of those are outside of the system. How do we capture those? So we're working with the private sector. There's a number of people that just do a great job in these areas. And so trying to work, giving them vouchers to identify these people, get them in their programs, and then send them to the VA for further help as needed. I think that's the way to go. So all of these things are being done in a very bipartisan way. You know, the nice thing, we hear a lot about all of the stuff that goes on here regarding you know, the lack of bipartisanship. These are areas where Republicans and Democrats work together very, very well. And we want to take care of the veterans in the sense that, you know, these aren't freebies. These are things that were promised to them. And again, that's what it's all about.
Well, hopefully you can get that through fairly calmly here, because we know up there in D.C., nothing ever really comes that easy. Senator John Boozman, we appreciate you taking a little time for us this morning.
Well, thank you for having me, and again, about such a very, very important topic.
Absolutely. We'll do it again soon, boss.
Appreciate it.
All right.